Okay, let's talk about two injuries that are, well, incredibly common. A torn ACL or that nagging chronic low back pain. We all kind of have this script in our heads, right? You get hurt, you see a doctor, you get it fixed. But what if that whole script is ready for a major rewrite? Today, we're going to dig into some really fascinating evidence that challenges what we think we know about how we heal.
All right, so let's start with what we usually think of as the standard playbook for these kinds of serious and, let's be honest, kind of scary injuries.
So picture this. You get that diagnosis from the doctor that you do not want to hear. Maybe it's that sharp, sickening pop in your knee after a bad landing, or maybe it's that backache that just will not quit. This is a reality for millions of us every single year.
So be honest with yourself. What's the very first thing that pops into your head when you think fix? For most of us, it's something high-tech, right? We're immediately thinking, I need an MRI to see what's wrong. Or, let's just schedule the surgery and get this fixed. Or, just give me some strong pain meds to get me through this.
Well, here's where things get really, really interesting. This right here pretty much turns that whole way of thinking on its head. This comes from a huge clinical practice guideline. We're talking the U.S. Departments of Veterans Affairs and Defense. And look at this list. These are the go-to treatments for so many people. We're talking benzos, steroids, long-term opioids, even some epidural injections. And the official recommendation for all of them, a massive strong against. Wow, that's a pretty powerful statement, isn't it? Especially for such common treatments.
So yeah, this all points to a really fundamental pivot in how we should be approaching recovery. And look, this isn't just some new trend or fad. This is a shift that's being driven by years and years of solid scientific evidence.
And it's not just back pain. This thinking absolutely extends to major injuries like ACL tears. I mean, check out this quote. It's from a massive systematic review, and you gotta know, that's like the gold standard, one of the highest forms of medical evidence out there. And it's a total game changer. It basically says that for a lot of people, the evidence that surgery is actually better than just managing it conservatively, well, that evidence is surprisingly weak. Let that sink in for a second.
And just to put this in perspective, this is not a small problem we're talking about. Look at this number. Way back in 2013, the U.S. spent an estimated almost $88 billion on low back and neck pain. Billion. With a B. That is just a staggering amount of money. And it really highlights why we have to find the most effective treatments, not just the ones we're used to. It's critical for our healthcare system, yeah, but also for our own wallets.
Okay, so you're probably wondering, if surgery and heavy-duty drugs aren't always the best first step, then who is a candidate for this other path? How do doctors even decide? Well, I can tell you, it's definitely not a guess.
For ACL tears, it turns out there's this really rigorous screening process. They're looking for what researchers call potential copers. And that's a great term, right? It means people who can probably cope, who have a really high chance of doing great without surgery. And it's a whole step-by-step thing. First, they check to make sure it's only the ACL that's torn. Then they put you through your paces with functional tests, like a bunch of single leg hops. And finally, they listen to you. They want to know how stable you feel your knee is. You have to pass all those checks to be considered a strong candidate for skipping the surgeon.
And you know what? It's a pretty similar story with low back pain. The very first move isn't to rush you off for a scan. Nope, it's all about a really thorough history and a physical exam. They're basically playing detective, looking for any red flags, signs of a more serious underlying condition. They have to make sure it's safe to take a more conservative route before they even think about moving forward. All right, so let's say you are a good candidate for this non-operative path. What does rehab actually look like? Well, it is so much more active, more dynamic, and honestly, way more interesting than you're probably picturing. Okay, for a knee that's missing its ACL, the absolute cornerstone of modern rehab is this thing called neuromuscular training. And you should think of it like this. It's not about just building bigger, dumber muscles. No way. It's about retraining your entire system, your brain, your nerves, and your muscles, to all work together like a super smart, coordinated team. They're learning to create stability to make up for the ligament that's not there anymore. And it's really fascinating how they get this whole process started. See, right after an injury, big, important muscles like your quads can just kind of shut down. They go to sleep. So therapists use these clever tools like neuromuscular electric stimulation, or NMES, to basically send a little electric signal to wake up those muscles and remind them how to fire properly.
And a really smart rehab program is all about the right combination of exercises. You've got your open chain stuff, where your foot is just moving freely in space. That's awesome for targeting and building raw strength in one specific muscle. But then you have closed chain exercises, where your foot is planted on the ground. Think of a squat.
That's what teaches all those muscles to work together in a real-world functional way. And you absolutely 100% need both to get back to full strength. And then you get to the really cool, advanced stuff like this. It's called perturbation training. What's happening here is they're literally challenging your balance, maybe on a wobbly surface, giving you little unexpected nudges. They're forcing your muscles and your whole nervous system to react instantly, automatically, to keep you stable. It's basically like a boot camp for your reflexes.
And for low back pain, the modern approach is just as holistic. It's not just about the physical stuff. I mean, yes, those same VA/DoD guidelines recommend things like yoga or Tai Chi, but they also put a huge emphasis on therapies that train the mind, things like cognitive behavioral therapy and mindfulness. It's about training your mind and your body, and even just educating you on the science of how pain actually works.
Okay, so let's tie this all together, because it really builds to a powerful new idea about what recovery means, and, more importantly, what your role is in all of this.
Because what we're really seeing here is a fundamental shift in the entire philosophy of care.
We're moving away from this obsession with fixing a structure that we see on an MRI or a CT scan, and this is a huge deal. I mean, we know from tons and tons of research that so many people are walking around with things like disc bulges on their scans and have absolutely zero pain. The picture, it just isn't the whole story.
And we're moving towards restoring real-world function. That's the crucial point. The new goal, the new finish line, is all about function. It's not about getting a perfect scan. It's about what you can actually do. Can you get back to your sport? Can you play with your kids without wincing? Can you just live your life with confidence? That's the real measure of success.
Which really leads us to this final, and I think kind of provocative thought. All this evidence suggests that the biggest revolution in healing, it's not some fancy new surgical technique or a miracle drug. No, the most powerful tool for recovery isn't a scalpel, and it isn't a pill. It's you, an active, educated patient who's a true partner in their own healing process.